Well, it's a nice small group, so it could be very informal. I'm lioYu, Dr. lioYu.
Okay.
I'm a board certified radiation oncologist. So I'll tell you a little bit about myself.
80th Street, that's my street.
Well, yes, I'm on 3rd Avenue between 80th and 81st. That's one of my offices. I actually have 3 offices. There's an office I have down in Tribeca on Broadway near Chinatown, and I have another office in Queens in Ozone Park. So I've been a radiation oncologist for about 25 years. So I've seen all different types of cancers, of adult cancers. I don't do pediatrics. I'm also a founder of lioYu Oncology, which is my practice. Also USA Cancer Care. USA Cancer Care is an organization we're trying to put together a center, erect a center to treat international cancer patients. I'm the founder of Cancer Life Prolongation Project, because there's a lot of misinformation out there. A lot of people are getting the wrong information, and it's impacting their longevity. Okay, I'm a New Yorker. Even though I was born in Taiwan, I came to New York since I was 9 years old. So I went to Stuyvesant High School when it was still down on 15th Street, and then after that I went to Yale College. I was going to be a basic researcher, so I majored in molecular biophysics and biochemistry. And then some people could convince me to be a doctor, so I can do clinical research and help patients. So that's what I did. I did my residency right down here, down in Beth Israel on 15th Street, which was associated with Mount Sinai, and was able to do a lot of time in terms of rotations here nearby in Sloan Kettering. As well as down in Boston, up in Boston, at the Harvard Joint Center, where there's the Dana-Farber Cancer Institute and Brigham and Women's Hospital. So I've been trained and mentored and know a lot of people that are world experts in cancer. So I should be able to answer most of your questions, okay? I have no conflicts. Okay, so this is my mom here, and she's an occasional Lennox house goer. So maybe some of you have seen her here. So that's kind of my motivation to do the good deed here. I actually live about 4 blocks away from here. This is my son. He just turned 18. That's his birthday cake. Okay. Okay. So the outline of this talk is we're gonna go over a general outline of cancer. We're going to focus a little bit on the most common cancers, which is breast cancer and prostate cancer. Okay, I'll discuss treatment modalities and the new advances. Then I'm going to go to some cancer facts and myths, and how one is able to sort out which is fact and what's not fact. Okay, and then at the end we'll do a conclusion and a question and answer. Okay, so welcome to the information age. Information now is doubling about every 2 years. 100 years ago, information was doubling about every 100, 150 years. So you can see how much information there is that we have to deal with. A lot of the information is fantastic, a lot of the information is garbage. So you have to learn how to discern what's real and what's not. Medical information actually is doubling even faster every 18 months. So just remember that people could be on the internet, anybody could be on the internet, and they could be saying all kinds of things and say it's true. Like for instance, they could say, drink 10 cups of coffee a day and you'll be cured of this cancer or that cancer. So you have to be careful what the source is, okay? So this talk hopefully will help you understand cancer a little better. Okay, so what is cancer? Cancer is basically a group of diseases that starts from a cell that goes bad, okay? A cell that doesn't know when to stop dividing and reproducing itself. That's cancer, okay? And it's the second leading cause of death in the United States. The first one is heart disease, okay? And it's a disease that's associated with aging. That's the major reason that cancer incidence is going up, because people are living longer nowadays. So in the past you had breast cancer, they said it was 1 in 11, there was 1 in 10, 1 in 9, now it's 1 in 8. And the main reason is people are living longer. And as you live longer, there's more chance for the cells in your body to go bad. It turns into cancer. So that's one of the major reasons, okay? Okay, so about 1.7 million new cancer cases and about 600,000 deaths per year, okay? So that means every day there's about 5,000 new cases.
From where?
In the United States,
Okay.
in the United States, okay? And about 1,500 deaths, okay? So that's a huge problem, okay? As a matter of fact, if you look around, if you turn to the one side and the other side, 1 of 3 people will have cancer in their lifetime. So, as a raise of hands, does anybody here themselves or know someone who has cancer? Okay. All right, it's a big problem, okay? So you should really know about cancer and what to do about it. Okay, so the most common cancer is, well, skin. Skin is the most common one. But usually people, us oncologists, we kind of discount it a little bit because it's so common, it's highly curable. Okay, I can give a whole talk about skin cancers. We can do that at another time. So the most common is lung cancer when men and women are together. But broken down by gender, the most common cancer in men is prostate cancer, and for women it's breast cancer. Okay, and this is just a partial list of some of the other cancers. Thyroid's in here, you know, you have other cancers. The one after this is colorectal cancer. GI cancer is very prevalent. Okay. All right, so let's talk about breast cancer. 1 in 8 women in the United States will get breast cancer, invasive breast cancer. Okay, so this is the list. So about 266,000 females estimated in 2018 will get breast cancer, and then after that lung, and then colorectal. You see, you have uterine cancer, thyroid cancer, melanoma, lymphoma, pancreatic cancer, leukemia, and this is the list of the most common cancers in females. Okay. So screening, mammogram is very, very important. Okay, so it should start at age 40. So you should the female should all be getting breast cancer, breast mammograms every year on an annual basis, okay? Even if you're older than a certain age, sometimes some doctors say, oh, you're past a certain age, you don't need a mammogram. That's not true. Just remember that you still need a mammogram at least every 2 years. At least every 2 years. So don't let your doctor say you don't need a mammogram anymore. You need it. Okay? If you know you have daughters or other friends, they should start screening about age 40. Okay? When they're younger than that, in age 20s and 30s, they should have a breast exam every 3 years. At age 40, unless they have a family member or family history, strong family history of breast cancer, they should get screened even earlier. So if somebody in your family has breast cancer at age 33, say age 33, 10 years before that time, the primary family member should get screened, start screening. So that means a sister should start screening at age 23. Okay? So if there's a strong family history of it, your screening can start earlier. But this is a general guideline. Okay? And people with a high risk should get an MRI. Although the MRI now is sometimes not recommended all the time. Okay, so breast cancer treatment. Generally, you need surgery first. Usually a biopsy is done to confirm that it's cancer or precancerous. Precancer is called DCIS, which is called ductal carcinoma in situ. That's precancerous, but it's still treated the same way as breast cancer. So surgery is done, and if it's a lumpectomy, they remove the lump, then radiation is usually given. Okay? And depending on what they see in cells under the microscope and what kind of studies they do, they can tell whether the patient needs hormones for 5 years or afterwards. Sometimes you can get an aggressive cancer, then chemotherapy might be needed. Or newer agents. Newer agents now are available. I'll discuss a little bit of that, okay, for certain types of cancers. that have certain genetic alterations, etc. Okay? So, now let's turn to prostate cancer. About 1 in 9 men will get prostate cancer. It's the most common cancer in men. Okay? And here we have the list. Estimate 2018. About 164,000 patients will get prostate cancer. The next one is lung. And then you have colorectal, bladder, melanoma, kidney, lymphoma, head and neck cancer, leukemia, liver. This is in the United States, okay? Keep in mind, worldwide, this is a little different. This is a little different, okay? In fact, in the other countries, for females, cervix cancer is one of the most common cancers, okay? And it's a big problem. And we'll talk about how cervix cancer incidence has gone down in the United States because of screening, like pap smears, and now they have this vaccine, okay? So, prostate cancer screening. Luckily, there's an easy blood test called the PSA, which stands for prostatic specific antigen, okay? It's just a simple blood test, and if it's elevated past a certain number, there's a good chance there may be prostate cancer. So it's a great test. I wish I had a test like this for all the other cancers, okay? The PSA should be done annually at age 50, okay? The other people at high risk, if there's a family history, they should begin this PSA testing earlier. Now, in the news over the last few years, there was some controversy. They talk about why PSA should be taken. Your doctor may be telling you, men, you don't need the PSA. We don't have to take that anymore. Okay, well, don't believe them. You get your PSA, okay? Because that's the easiest way to detect prostate cancer at an early stage, which is curable.
Is that a blood test?
It's a blood test. It's a simple blood test, okay? So these academicians at Harvard, they come up with these things that, oh, the PSA is really not necessary. It's over-treating patients. Well, now they're reversing themselves. Last year, a study came out. This was from Time Health. Getting tested for prostate cancer may be worth it after all. In this study, it showed that the PSA could be linked to as much of a 32% decrease in prostate cancer deaths. Okay, so get your PSA. If you're a male, get your PSA done. Ask for it. If your doctor says, "Oh, this study says you don't need it," well, tell them that's not true. Okay, get your PSA, because the easiest way to cure cancer is to find it at an early stage where it can be cured. Okay. So treatment for prostate cancer actually is pretty easy. Usually it just needs radiation. You do not need surgery or chemo in general for early stages, okay? Now surgery can be done in some patients if it's early stage, but that's fallen out of favor because the surgery actually can cause certain types of side effects and complications that the radiation doesn't, okay? So for the most part, prostate cancer patients get radiation. And some people get hormones, okay? And they have some amazing new machines to pinpoint the prostate cancer, which is an organ that's in the middle of your body. They can come in from different directions, and these machines are pretty incredible and very, very precise. And they give a high cure rate and give a low complication and side effects, okay? And there are also new drugs that's come out over the last few years that target certain prostate cancer types that are advanced, or they don't respond anymore to hormones. They have different drugs now available. In fact, there's a new drug out that is a radioactive drug that's injected and seeks and destroy bone metastases from prostate cancer, and it actually improves the patient's survival, even in stage 4, okay, which is the highest stage. Okay, so here are the modern treatment categories. You have surgery, you have radiation and chemotherapy, or systemic therapy. The systemic therapy includes immunotherapy, some targeted agent, etc. We're going to discuss that some more. Okay, so many of you probably heard about the new things like immunotherapy or targeted cancer treatments. So I'm going to discuss some of this. So immunotherapy is usually a drug that stimulates your immune system to target cancer cells. Now remember, a cancer cell is a cell that kind of goes bad. So something happens to that cell that makes it grow when it shouldn't be. Okay, so these drugs help your immune system to fight these cancer cells, but with your own immune cells. Okay, and there a lot of it can be antibodies, and it could be non-specific, like interferon is more just general. It just kind of stimulates your immune system to go to rev up. Okay, there's also a viral type or T-cell therapy and cancer vaccines. That's part of immunotherapy, and it's also called biologic therapy. Okay. So this is just a list of some of the immune checkpoint inhibitors that's been developed recently in the last few years. Okay. So this arsenal is available to your oncologists. Okay. If they keep up with what's happening, you can be tested to see whether you could use any of these agents. Okay. Okay. So let's talk about viruses and microbes. Can viruses and microbes cause cancer?
Yeah.
And the answer is yes. Yes. Okay. But the cancer patients are not infectious. So you don't have to worry about being with a cancer patient because they will not infect you. Okay? So the most prevalent viruses that we're talking about these days is the human papillomavirus, HPV. That is thought to increase the risk of cervix cancer in females and head and neck cancer also. All right? And there actually is a vaccine now available to vaccinate against HPV. So for the children, prepubescent females, there's 3 shots that they can be given to help prevent them from getting cervix cancer. Okay, hepatitis B and C is associated with increased risk of liver cancer. Okay, so being vaccinated against hepatitis B is a good idea. Okay, against 3 shots. Okay, other viruses can cause some rare types of lymphomas, like in Africa, Epstein-Barr virus can cause a Burkitt's lymphoma. That's a rapidly growing lymphoma that can occur. Okay, there's another one, HTLV, that's a human T lymphocyte virus that causes adult T-cell lymphoma or leukemia. Okay, now very important. If you have a stomach ulcer, people usually think, well, I have too much acid, I have too much stress. Well, it's now known that a particular organism called H. pylori, okay, is responsible for a lot of ulcers and cancer arising from stomach ulcers. Okay? It can also cause a type of lymphoma, or gastric-associated lymphoma. Okay? So if you or anybody else have an ulcer, they could do a scope and they could check to see whether this is this organism. This organism then should be treated aggressively with an antibiotic. Okay, and that could. Well, yeah, sometimes ulcers can be. Okay, acid reflux also is thought to cause changes to the esophagus. That may be the reason that esophageal cancer, a particular type of it called adenocarcinoma, is going up in rates, in incidence.
Excuse me, Dr. Kayas, I have this acid reflux for many years, and
Yeah.
I have to take the same medicine all the time, like for 20 years.
Yes.
I'm a paranoid. I take that 20,
Yeah.
milligrams. But I'm afraid they can give me cancer too. I don't know how.
Well,
you think it's
you
the
should
best
continue to take the medicine,
Huh?
because if the medicine helps decrease the acid reflux, that would be better. Because irritation of the mucosa of the esophagus is thought to maybe contribute to it changing. Okay. Yeah. So going back to the H. pylori, the lymphoma that's caused by this H. pylori actually is cured sometimes by antibiotics. So that's interesting, right? So you can have a type of cancer that's cured by an antibiotic. Okay? So, okay. We talked about this already. Okay. Targeted therapy or precision medicines, okay? So they target a specific molecular area on a cell, okay? So some cancer have something wrong with a particular part of a gene, okay? And they were able to map this out and figure out what part of the gene went wrong, and they find these medications to specifically target that and fix the problem, okay? So there's a lot of new targeted therapies, okay? For instance, one of the most common targeted therapies in breast cancer is something called Herceptin, okay? So when they do surgery for breast cancer, they check for receptors for hormones, okay? They also check for this thing called HER2. HER2 new, it's a particular part of the gene that can be mutated, okay? And that causes the cancer to grow faster, okay? So that's a bad thing. However, the good thing is there's a medication that targets those cells. So the Herceptin can dramatically eradicate those cells or kill those cells, okay? So there's a lot of new targeted therapy. This is just a partial list, okay? This list only includes the ones starting with the letter A. You see how many there are?
Yeah.
Okay? There's about 80 to 100 of them. And some of them do the same thing, okay? Multiple drugs does the same thing. But there's a lot of targeted therapies out there, okay? And your doctor should have access to a way of testing your cancer cells or any cancer cell whether they are responsive to this type of targeted therapy, okay? So if you know somebody who has cancer, breast cancer, or some other type of cancers, there's assays and tests out there that are available to the oncologists that they could test for certain targets so that they just won't get the particular type of chemotherapy that's traditionally given. They could benefit from some other targeted therapies as well. Yes, go ahead.
Excuse me for saying this. I have a lady friend who lived in Queens, in Kew Gardens, and she cured herself of bone cancer with holistic medicine, going through the library and researching that area, and living in Florida. What do you think of that situation?
Okay, I'm going to get to that in a minute regarding facts and myths. And okay, so I'm not doubting that you know this lady. Okay, so just hang on about 10-15 minutes. I'm going to get to some of this explanation.
I have a ride coming back.
Oh, you do?
Yeah, so
Okay.
I have to leave, but one other question. The other one was, the other person had rectal cancer and was at Sloan Kettering
Mhm.
and did the radiation
Yes.
and all
Chemo.
the other things you mentioned,
Yeah.
and she died.
Well, of course, there's no guarantees that everything can be cured. Okay, so, okay. Thank you for attending. Take care now. Okay, so technological improvements, okay? So we can use radiation to pinpoint certain areas and kill cancer cells without having to go do surgery or cutting and opening the body. Okay, some of these technologies are called intensity modulated radiation therapy or image guided radiation therapy. That's abbreviated IMRT, IGRT, and stereotactic radiosurgery that can be done any part of the body or the brain tumors. Okay, and it really relies on the advances, the tremendous advances in computing power that's happening and imaging. So I'm going to show you a video. Let's see if we can get this thing to. Hold on a second. Let's see how this works.
Some call it a magic bullet in the fight against cancer. New medical technology is allowing doctors to use a precise beam of radiation to destroy tumors without damaging any other part of a patient's body. TechLive's Victoria Ricano shows us how it works. Next generation medical treatment is using a host of high technology for what's called the Smart Beam IMRT. That's short for intensity modulated radiation therapy. It's helping pinpoint the battle against cancer.
It's close to, I think, a paradigm change from the patient's point of view. The patients now, in a timely fashion, can achieve a therapeutic outcome that should enhance cure rates, but dramatically should decrease side effects.
The advanced technology was pioneered by Varian Medical Systems in Silicon Valley. It focuses higher doses of radiation on cancerous tumors while sparing surrounding tissue.
It allows a much more precise location of the beam, as I understand it. And I also have a new titanium hip bin, and that tends to reflect beams all over the place, so they need to be able to work around that as well. So this allows a very precise image to hit the prostate.
Using image acquisition software to custom design individual treatments, the Smart Beam system first uses computer-generated images to map out a treatment plan. Using Smart Beam IMRT, cancer therapists paint a precise increased dose of radiation, matching the shape and depth of each specific tumor. They can even wrap the radiation safely around the spine to avoid potentially paralyzing it.
This new equipment is almost like a magic bullet version of radiation. It preferentially gives a dose of radiation to a tumor, and it avoids damage to the healthy tissue nearby the tumor.
The Smart Beam uses computerized medical linear accelerators, along with a multi-leaf collimator, a computer-controlled mechanical device using 120 movable tungsten leaves. They can form the shape of the radiation beam to the exact shape of the tumor from any angle.
You don't want things outside the area to get fried when you're just going to treat the tumor.
Before treatment, technicians work with the computerized planning system to visualize a patient's anatomy in 3D, then see how the treatment will impact that patient.
It turns over to the computer many functions that would require huge numbers of human beings and lots of time if computers didn't exist. So the number of things that go on in a treatment is immense. No human being could do all these things without help from a computer.
The Smart Beam IMRT software helps radiation oncologists calculate the specific number of beam angles, shapes, and exposure times for each tumor. Treatment simulators locate the tumor and precisely position the patient.
You know where they are, you see them, and then you treat them very precisely. That's possible today, and it would not be possible without the power of the computers that are built into this system.
Smart Beam IMRT therapy is done on an outpatient basis, making it more convenient and much faster for patients. Treatment usually takes just 10 to 15 minutes.
All right, let me just go back to the lecture here. Okay, so that's some of the precision things, and there's also a machine out there now that can theoretically follow a patient while they're doing jumping jacks and treat them. Okay, so the technological advances are amazing, and we can do a lot of different things now that we can't do 20, 30 years ago. All right, so here's a question. Is there one cure for all cancers? Okay, now a lot of people believe in this conspiracy theory that the government knows a cure for cancer, or the drug company knows a cure for cancer, but they're hiding it because they want to make money, okay? Well, unfortunately, cancer is really not one disease, okay? There may be one drug or there may be something that could cure a particular cancer out there. Maybe it's been hidden, who knows, okay? But cancer is really over 100 type of different diseases. So you can't really have one cure, okay? You can have certain drugs that can apply to a lot of different cancers, okay? So there isn't one cure out there, okay? However, the most common cancers that we have in men and women are being cured, like breast and prostate cancer, okay? And we know how to do it.
Which cancer?
Breast and prostate cancer.
It's being cured.
Yes. So most breast cancer patients are being cured nowadays.
Oh, you mean by the chemo and the surgery?
We're not accepting questions now.
Yeah. Well, you know what? You have short questions, you know. But in general, yes, breast cancer, early stage breast cancer is being cured. Okay, I've been doing this for 25 years, so it's really a great thing. And prostate cancer as well. Okay. But not all cancers can be cured. Okay, there's certain ones that are worse than others. Like pancreatic cancer is a very challenging one. Okay, they can be cured, but it's a much lower rate. Or brain cancer could be, is a tough one. Okay, so there's still a lot of work that needs to be done. That's why there's a lot of research still going on, and hopefully there'll be some breakthroughs that will help specific types of cancers. Okay, so let's turn to the facts and myths. Okay, okay, supplements. Can vitamins decrease your chance of cancer? Did anybody? Can somebody raise their hand? Anybody want to raise their hand and say yes or no? Yes.
So they said something. There's a pill that has the cruciferous vegetables in it, dim or something.
Okay.
Or what are the vitamins?
All right. So let's.
I'm asking you what to tell me. I don't know.
Yeah. So let me just go to the next slide and let's talk about vitamin E. Okay. Vitamin E or selenium has been thought to decrease maybe prostate cancer. Okay. So here's a placebo-controlled study that shows that you have somebody who gets vitamin E or selenium versus a placebo, or both versus placebo. What's the result? There's really no significant difference. Okay? So taking vitamin E or selenium may not really decrease your chance of prostate cancer.
What about breast cancer? Breast.
Well,
Same thing.
no.
Same
Not. There's no studies that demonstrates that. In fact, can vitamins increase the risk of cancer?
No.
Vitamin E, can it increase your risk of cancer?
No.
Yes. Guess what? Here's two studies. There's a study on vitamin E and vitamin A. Vitamin E has thought also to maybe decrease risk of head and neck cancer in patients who had head and neck cancer before. People who had head and neck cancer have an increased risk of getting another one, or another cancer in the esophagus or the lung. So they thought, well, if we give them extra vitamin E, maybe it'll decrease their chances of recurrence or new cancer. And this study was done on nurses, by the way. They found that people who took extra doses of vitamin E had an increased risk of getting another cancer. Okay? So don't think that vitamins are always good for you. You better check. Okay? Vitamin A, beta-carotene, was thought to decrease cancer, lung cancer in patients. Okay? Well, they did the study, and they found that smokers or former smokers taking beta-carotene, vitamin A, had a higher risk of getting lung cancer. Okay? So this is the beta-carotene group, and this is the patient who had no beta-carotene group, and this is the incidence of lung cancer. You see how this curve with the beta-carotene is actually higher. Okay? So everybody is listening to whatever on the internet. Oh, take this vitamin, take that vitamin, take this supplement, take whatever. You got to be careful. You got to know whether there's actually fact behind it or is just a myth.
There's been a study recently on those two vitamins.
Yes. The vitamin E, actually, there's been a study that's been updated, and they found that it confirms that it increases head and neck cancer.
What
Okay?
about, is there any vitamin or mineral or maybe the precipitous dim vitamin that will help with the breast cancer, help prevent it?
There's nothing that I know of. There's nothing that I know of. Okay? Now, that's not to say that there's not something out there that will help. Okay?
But would you
That's
know
not.
all
But we can only rely on evidence-based information to say you better take this because it'll help you. Okay?
So then there's no vitamin or mineral that's going to help prevent the breast cancer, even the dim they keep. I'm asking you, even the dim that they're always advertising. it
Yeah,
has
not
precipitous-
that I know of. Not that I know of. But I'm gonna ask you to hold your questions
Okay,
till the
thank
end.
you.
Okay?
Okay.
Okay. How about sugar? Say people say, oh well, sugar. You know, you take the sugar. The sugar's feeding the cancer. The
Yeah.
cancer's gonna grow faster. Right? Is that true?
No.
Not really. The sugar is absorbed by your body, and you can get.
Diabetes.
It gets. Thank you for attending. Your body will absorb the sugar to help, nourish your body, and it also will nourish the cancer cells. Okay?
It will,
So-
you say it will help the cancer cells, the sugar?
No,
Oh.
no. So don't worry about sugar. Okay? If you need to take sugar, you can. However, keep in mind, if you have diabetes or you don't want to get fat, you better not take too much sugar. Because guess what? The highest mortality rate in the U.S. is heart disease, and sugar is tied to that. Okay, so not taking a lot of sugar is a good idea because you don't want to get fat. Okay, or contribute to diabetes. Okay, but it has nothing to do with cancer. Okay. All right, so moderation is key. Okay. So don't take a whole bunch of different vitamins. Don't take a mega doses of this or that. Okay, moderation. If you eat a nice balanced diet. Now, the vitamins are necessary in your body. Okay, I mean you need to have a certain amount, a minimal amount. The daily recommended allowance of vitamins is important. Like if you didn't have any vitamin C, like the sailors many years ago, they had rickets. Their bones would get soft, right? So you do need a certain amount of vitamins. But mega doses of vitamin, is it going to combat cancer? Not necessarily. It can actually be worse for you. It may actually increase your risk of cancer. Okay? So, another thing about vitamin C, by the way, is it should not be taken during radiation. Okay? Vitamin C is an antioxidant. So, that's something that's, okay. So let's talk about statistical evidence, okay? So this is the evidence that we rely on to say this is good or not, okay? So the best evidence is a double-blinded study, placebo-controlled study that is randomly assigned to people, and prospective, meaning it's not looking back, it's looking forward. And you gathering the data as the information comes in about which one is better. Okay, so whether taking vitamin or not, and you go forward 10 years, 5-10 years, and of course the longer time you have, the better it is. Okay, this is the type of evidence that we always try to use as doctors. Okay, so to recommend treatments that's going to work or not. Okay, now as opposed to anecdotal evidence. The lady that was here, that's left, who said that someone was cured of bone cancer. That's a story, okay? So anecdotal evidence is it cannot really rely on it to say and generalize it to everybody else, okay? It's not, and sometimes it could be miracles, it could be true, and it's used by a lot of people on the internet with false advertisement because they have monetary gain, okay? So if you have a product and you want to sell, you can come out with all kinds of statements that it's the best thing in the world, it will cure you of this and that, and buy this, okay? So you have to be careful. Beware of fake news report, okay? And if you really think about it, some of it may sound absurd, but people do get scammed. So you have to be careful, okay? And especially if it's worked on a story. All right, so let me give you an example. It's a miracle berry or substance, okay? Advertised as natural cancer killer, 10,000 times stronger than chemo, okay? This was actually found on the internet. My assistant found it, okay? So let's just look at this miracle berry. Jane uses this substance, whatever it is, okay, every day, religiously for years, was active and happy, lived to over 100 years old, never had any cancer. So now you can get this substance and be cancer-free, live to over 100 years old. So you're going to get out your checkbook, or you're going to get your credit card out and buy this?
No.
Well, yeah, but a lot of people fall for this, right?
What berry
So,
are you talking about?
so what do you think this? So what substance could this be? Substance be that cruciferous vitamin type of thing, right? You're probably paying some money to get that, right? Or somebody in your family paying for that.
Right.
So what do you think this substance I'm talking about is? Tobacco. Everybody knows someone who smoked like a chimney for years, lived to over 100, no cancer, right? So can we conclude then that if you smoke like a chimney, 3 packs a day, you can live over 100? No, because if you took 100 people and you gave them 3 packs of cigarettes a day, guess what? Most of them not going to make it to 100. You know? Okay? Right.
They have a stronger constitution. Some have stronger.
Right. People vary. Okay, so you have to be careful about anecdotal evidence or stories. Okay? You have to really see what's the proof behind what their statements are. Okay? Smoking and cancer. There's no direct proof per se, but there's a very strong correlation with smoking and lung cancer. Okay? So here we have tobacco use going up from 1900s, okay? And this is male lung cancer death rate. Lung cancer. You see? That's a pretty strong correlation, wouldn't you say? That's why the Surgeon General makes the cigarette, packs having that label, that warning.
That's why the tobacco industry is being sued all the time.
Exactly,
That's why
yes.
smokers, the tobacco
Yes.
industry.
Right. So, yeah, smoking is not good. It causes, not only it increases your risk of getting lung cancer, but also heart disease, which is the number one killer. Okay? Also, another thing about, even in the news, you get certain news channels or newspapers, they say, there's a breakthrough. Remember interferon 20 years ago?
Yeah, 20 years ago.
Interleukin, interferon, that's the cure for cancer. Remember that? Well, now, guess what? It doesn't really do much. Okay?
It doesn't
Okay.
help the immune system.
Well, it does help the immune system.
It does help.
It does help the immune system. It may help hepatitis patients. Hepatitis C or, So, but this breakthrough never really came through, never became a
And
breakthrough.
it helps people with autoimmune illness.
Yeah, some, right. So also be aware what you hear on the newspapers and in the radio and the TV, okay, or on the internet, and particularly the internet, okay. These breakthroughs may not really be breakthroughs, okay. In fact, every time I look at an article in a newspaper or the news channel when they report on some medical issue, I always find that there's always something they get wrong. They always get it wrong.
It may have helped some people. It was being used. There must have been some testing.
Yeah, but it wasn't the cure-all that they touted to be.
But
right?
it did help some people.
Yes. Right. Okay, how about alkaline water? Alkaline water. Does that there's I guess trend for people to say that your body, if it's acidic, it promotes cancer growth. Okay, so if you alkalize your body, it'll kill your cancer cells. So it'll improve your.
Alkaline, what is it?
Alkaline is a pH that's you know what acid is, right? The opposite of acid is alkaline or base. Okay, so that has to do with the balance of acidic, right? It's acid in your body.
In what
Okay.
water?
Well, they sell these bottles of alkaline water because it's very basic. Okay, they say if you drink it, it's good for your health. Okay.
But wouldn't anti-inflammatory foods, because cancer is inflammation, wouldn't that help if one was on a diet of the anti-inflammatory foods? Wouldn't that help ward off the
Yeah, well, cancer is not inflammatory necessarily.
Well, I
It
can't
can
hear
be.
you. I cannot hear you.
Cancer's not.
I want to hear you.
Yeah, cancer is not inflammatory.
She answers for me.
Yeah.
What was the answer to the question?
Anti-inflammatory foods. Let's get to that afterwards.
Could you just answer that one
Yeah.
question? She interrupted it. Go ahead.
Yeah.
I heard that anti-inflammatory foods helps with the warding off cancer.
There's no direct proof of that,
Okay.
as far as I know.
All right.
Okay, but alkaline water is one of those things where it says if you decrease your if you increase your pH to a more alkaline state, that it's hard for cancer cells to survive that
So you
state.
should drink alkaline water.
No, no, I'm not saying that. Okay, so this is so, but a lot of people are buying. My sister also bought a whole case of it from Costco, alkaline water. Okay.
So is that going to help her?
What is alkaline water?
Alkaline water is water that has less acid.
Listen.
Yeah, less acid. It's more alkaline. Okay. So the truth is, your body needs to have a specific pH balance to function properly. Your blood has a certain pH that it has to maintain. If your body does not maintain this pH, your body's not going to function very well, and you can die. So it's regulated very, very precisely. Okay. So is alkaline water really going to change the pH in your body? Not really. Okay. Now, if you drink a lot of it, it can, and it'll send you to the hospital. Okay. But another thing with alkaline water, if you look at the studies, if you look at how they produce it, it's actually generated using platinum electrodes. Okay. So they make a different charge, a negative charge. So the negative charge or the positive charge causes the water to be more acidic or more basic. Okay. You can actually get a higher concentration of platinum, which is on the electrode, in the water itself. So you may actually be subjecting your body to a heavy metal, platinum, that you shouldn't really put in your body. Okay? So the alkaline water, unfortunately, my sister bought that thing. I took the whole case and threw it out. Okay? She was not happy about it, but she understood what happened. Okay, so cancer, who should I believe, what should I do? Okay? So my advice is you seek out a well-trained, experienced, and board-certified doctor and ask your questions. Okay? Don't be afraid to ask questions. And if you're recommended by a doctor to do some major medical procedure like surgery or get radiation or chemotherapy, get a second opinion. Okay? Good doctors will not care if you get a second opinion. Okay?
Say that again.
Good doctors who know what they're doing will not care if you get a second opinion. Okay? Because it will only validate what they're doing. Okay? So whenever, over the last 25 years, when the patients ask me, I'm thinking about getting a second opinion, I said, please do, but do it quickly. You know, do it quickly so that we could, get your treatment started, proper treatment started. Okay? So get a second opinion if you're going to have surgery, especially if it's major surgery. If an organ is going to be removed, let's say your bladder is going to be removed. Somebody recommends your bladder be removed. Well, get a second opinion before that changes your life forever. Okay? Chat with your friends but listen to your doctor. Okay? Chat with your friends. Don't necessarily believe what they say, because keep in mind, their situation may be different than yours. If you have prostate cancer, you have a friend who had prostate cancer, they say, oh yeah, I have prostate cancer, this is what I did, this. Okay? Well, that may not apply to you. Okay? So you better check with your doctor who knows your specific circumstance. Okay? View miracle stories with skepticism. Okay? So, what's a best way to prevent and deal with cancer? Get your physical, see your doctors, do your screening, whether it's a mammogram, your PSA, or Pap smear. Okay? The vaccines are now becoming more and more available. Okay? For the prepubescent females, they should get that vaccine
Vaccine for what?
HPV against viruses. Okay. Of course, you should get your vaccines against the flu also. You know, the flu and pneumococcal pneumonia. Those things are good. Okay. In general.
What is HIV? What is it?
HPV,
Yeah.
human papilloma virus. Okay. By the way, I have a little certain rule of thumb. I take vaccines, but I only take the vaccine when I'm feeling good. If I don't feel, I'm a little under the weather, I won't go for that shot that day. Okay? Yeah. So,
That's only preventative to that.
well, yes, yes. Okay? Eliminate unhealthy behaviors like smoking and not drinking a lot of alcohol or things like that. Okay? Find the right doctor and know your cancer facts. Okay, so don't fear cancer. Cancer is not automatically a death sentence. Nowadays, we have many people who are alive who had cancer and were treated and cured. Okay, the two most common cancer affecting men and women, which is breast and prostate cancer, right, is cured if detected early. About 90% or higher cure rate for early stage breast and prostate cancer. Okay? In the US, overall cancer rate is very, very high. This includes everything, including really bad ones. 70%. So we have an excellent medical system here. Okay? So take advantage of your doctors, but make sure they're qualified and keeping up on things. Okay? And don't worry about asking questions or getting a second opinion. Okay? As opposed to other places. China, cure rate is 25%.
Oh, it's very low.
20%, 25%.
For what? There's no.
Yeah.
Too low.
Okay? So we're very lucky here. Okay? So to summarize, the most common cancer in men and women are prostate and breast and lung cancers combined. Okay? Highly curable if detected early. Standard treatments include surgery, radiation, or chemotherapy, and we have new targeted agents, immunotherapy, biologic agents, and precision radiation therapy techniques that are available. Okay? There are many myths out there. None of them based on a story or there's actually a study behind it. A well-controlled study that's published in a well-regarded peer-reviewed journal, like a medical journal, okay, where doctors are on the editorial board and they look at the study and say, this is fine, this is not a piece of garbage. Okay? Cancer cure rate is high in the US, but you must be diligent in seeking the right board-certified doctor. Okay? And don't be afraid to get second opinions and ask questions. Okay? And my assistant did a lot of these slides, so I have to thank her for that. So, any questions? Yes. Yes, go ahead.
Lots of researches were made regarding cancer and its cure. Were they able to discover the effective cure of cancer?
The cure for cancer?
Yeah.
Well, cancer is more than 100 different diseases, so it depends on what type it is. So there's certainly cures for certain types of cancer, like prostate cancer and breast cancer.
Were they able to discover the effective cure?
There's no one cure. There's no one cure. So it's 100 different diseases. You need 100 different ways of treating them. Some are effective, some are not. Okay.
Okay. Is cancer transferable?
Transferable?
Yeah.
No, in general it's not. You can't be infected.
It is inherited?
It can be inherited, yes. There's a high rate of certain cancers in family members, yes. There's a genetic link. Remember, some cancer occur because a portion of the gene goes bad, and then that cell then becomes what's called immortal, and it keeps dividing and doesn't know when to stop. Okay? So, yeah.
Well, my story could completely different what I've been talking about. I was cooking at a square table, a high table, and my eggs were running down on the table. I tried to catch it before it fell down on the floor.
Yeah.
And bumped my breath.
Yes.
Because I would bump my head there. It would be the big lump too, right? I had a big lump there.
Yes.
So I have to have my yearly physical.
Yes.
Of course, they look at your breath, right? So what do you have in there? He made me laugh. Don't you know he was showing my belly? What do you call it?
Yeah. Yes, your breast.
Yeah, but see, don't you know what it is? Yes, we have a lump there. Then he took his phone. I want to go downstairs, she said. I told them they do the doctor downstairs. And he said, she has a long head. Urgent because of the big one. And they did a biopsy.
Yes.
The doctor downstairs.
Yes.
He took cut up the lump.
Yes.
All around. Bleeding all down in my waist here. The blood went in there. For 2 weeks it was blood was staying in there. And then he said, okay, very serious, he said. They started to do biopsy. After that they told me radiation and
Oh, radiation and surgery and chemo. So you know what? Why don't you see me afterwards? I want to answer any other questions there may be. Yeah.
And
Yeah.
I didn't go to the doctor.
Oh, really? We need to talk. Stay around afterwards. Go ahead. Your question.
I know that second opinions are highly recommended.
Yes.
However, in my case, my particular case, I did not go for a second opinion. But I had the operation done, thankfully successful, except that I didn't really appreciate the outcome because I lost my lower eyelid to cancer.
Oh, really?
My lower eyelid. And the reason why that happened is because I went to an eye doctor before this happened, before the diagnosis. And the eye doctor said,
Yeah.
can we stop that conversation going on here? It's okay, continue.
Yeah, I'm listening. Go ahead.
The reason why I went to
The eyelid?
to the oncologist. Her name is Dr. Kroll, you know her, Kroll.
No.
Okay. The reason why I had it done is because my eye doctor went for an examination. He said to me, what is that growing on your eyelid? Little blonde hairs, like tiny little blonde hairs. I said, I don't know. He said, have someone look at it. So when he said that, so, you know, I thought maybe he has something in his mind, but he's not telling me. So I went to Dr. Cole, and she's a specialist in that type of surgery, and she does cosmetic surgery and that type of thing. And she said I had a cancer in the lower eyelid.
Really?
So she removed my lower eyelid. Yes, I lost my lower eyelid. There were no eyelashes growing at all on the lower eyelid.
And when did the cancer come from?
Didn't say. But a biopsy was done.
Yes.
And the biopsy showed that it's cancer.
Okay.
It probably was, what is the lowest type of cancer? The lowest type of cancer, like a skin cancer.
A skin cancer?
What do they
Okay.
call that?
Like a basal cell?
Something like that,
I
yeah,
see.
probably.
Okay.
It was removed, but you know, I had no bad effects afterwards, except I lost my lower eyelid.
Right.
But
Well, with regard to skin cancers, interestingly, skin cancer on the face, ear and nose in particular, is better treated sometimes with radiation as opposed to surgery. So your dermatologist usually will do surgery. However, on the nose or the ear, it can cause a big defect. So radiation actually may be a better choice, but the dermatologist may not send you to the radiation oncologist for a consultation. So you should know that as well, okay? Radiation can be used to treat skin cancers very easily and effectively, particularly on the face and ear.
You know, it's water under the bridge. I still,
Yeah.
I thought about it.
But if you had skin cancer before, you should get skin checked every year.
I
And
had skin cancer twice on my face before this surgery on the
Yeah.
eye.
right.
I
Well,
don't
next
know,
time you
I
next time you
don't
get it,
think-
if they say they think there's a cancer, you might want to. You can call me if you want. Take my
Well, I
card.
had a biopsy.
You know.
You know,
Yeah.
that's what- that's
And then I can tell you whether radiation may be a better choice for you and less disfiguring.
Radiation around the eye.
Around the eye, or around the ear, or the nose. It's better because you don't have to cut. Sometimes they do the Mohs surgery. They actually have to cut,
I
and it
think
gets
that's
very
what it
deep.
was a Mohs surgery.
Yeah.
Yeah.
Right.
MOHS, right.
Yeah.
Mohs surgery.
So there's a new piece of equipment now that can treat skin cancers on the face very easily.
But you know, I thought about it a number of times, and I said, I have a feeling that it should never have been done. That's the,
Well,
of course, it's water under the bridge, but that's
yes.
the feeling I had.
Well, no, it's not improper for them to remove it surgically. It's not improper. It's just but you have choices.
Evidently, those
Yeah.
hairs did
Yeah,
not
just-
belong on top of the eyelid, you know what I
Yeah.
mean? Belonged underneath, but not on top. It was
So
growing
you
on
have
top.
you have a question? Oh, okay. Any other general questions about the lecture or cancer? Okay. All right. Yeah. Oh, 1 second.
Can
Yeah.
I be exempted from having a breast cancer? Because I have two sisters that already been removed some of their
The breast.
Yeah, but they're successfully.
Yeah. So you should be getting mammograms, and you should be doing self-examinations every month. Are you doing that?
Yeah, before I know it, but I'm scared because it's really painful.
Okay, so that's a really good question. I want everybody to pay attention to that. Yeah.
What was that?
Doctor,
Okay.
please repeat it.
Yeah. Okay.
Girdles.
Oh, you know what? Do me a favor. Can you?
Hello, miss.
Can you take this outside? Yeah, yeah. We'll come back in afterwards. Okay. So, breast cancer screening with mammogram is very, very important. You should do it every year. And guess what? If it doesn't hurt, they're not doing it right. Okay? If it doesn't hurt, they're not doing it right.
You mean during
That's
the
unfortunate,
examination?
but that's something
Is
you
there
have to go
any
through.
way that they
Okay?
can change that?
Yes. Well,
So scary.
some people do an ultrasound, okay, but it doesn't replace mammogram. MRI actually can detect a lot of things. The problem with MRIs is that it can detect a lot of things that are benign too. So you might end up getting procedures for nothing,
Right.
So the mammogram is still the best thing. Now, the reason you have to do the mammogram and not just rely on self-examinations is this. 90% of the time, you will not feel something, and it can show up on a mammogram. Okay? So most of the time, you do a self-examination, you'll feel nothing, and the mammogram can show it up.
If
Okay?
the mammogram shows up that you're okay, but there's still a little nodule, a small nodule, and
Then you still getting investigated. That's
And
why you need to do
sonogram.
both a self-examination and a mammogram, because 10% of the time, the mammogram will show nothing, but there's still a cancer
but the
there.
sonogram is benign. The features is benign. So.
Well, the sonogram, then that's fine. Then that's fine, because people can have cysts, okay?
Will they have
But-
fibroad,
Fibroad, yeah,
or fatty,
fibrocystic
or
disease.
fatty tissues? What is that? Fibro something or other?
Fibrocystic disease.
Yeah, they have fibrocystic disease, so
Yes.
they get these little small 1 point something.
So the thing is this: if you're afraid of getting the mammogram because it hurts, you really just have to do it, okay? Because if you can catch it early, you can be cured. Just like colonoscopy, we didn't discuss that, but colonoscopy at age 50 and higher should be done at age 50, and then usually it's every 5 to 10 years after that, okay? Because if they find a polyp, they just remove it, you're cured. But if you don't get it done, and the polyp's there, and it grows over several years, then you're gonna have major surgery, you might need chemotherapy, and you might need radiation.
Do all polyps become cancer?
No, not all polyps. A lot of polyps are benign, and there's certain ones that are not cancerous. But there's a lot that are cancerous, especially if there's a family history. Then you should get, colonoscopy more frequently. But remember, once they remove the polyp, you're cured. That's a great way of, being
So
cured.
it will never grow back?
So with the breast cancer, I've had a number of patients over the years. Some, unfortunately, were afraid,
Yeah,
okay?
that's
And they noticed something in their breast. They're afraid that it's cancer. They waited and waited and waited. Waited sometimes several years, 5, 10 years, or even longer. By then, it becomes incurable. Okay? So if you suspect something, take care of it. Take care of it right away. In fact, on my website, if you go to my website, lioYu Oncology, I have a patient who actually talks about the fear of cancer, of finding cancer. Okay, I cured her of breast cancer about 17 years ago, and she had her mother and a bunch of other things. Okay, so listen to her. I have her a video testimonial. So don't be afraid. In fact, just don't keep your head in the sand. You have to address it. Yeah.
There have been several studies about the advances of cancer in Israel. Are
Uh-huh.
they in line with the advances of cancer in the United States?
Israel actually has a very good medical system.
Yes.
Okay, and they have some innovative things going on all the time. However, there's more stuff going on here. There's more advances here, and some drugs are available here, but not available in other countries.
My sister-in-law who lives in Israel has breast cancer, and she's doing very well.
Yeah.
And my brother tells me, we talk on the telephone very frequently, he tells me how she's advanced, and he tells me about the advances of cancer in Israel as compared to the United States. I found it very interesting.
Yeah. There's some very good doctors there. They have some very good medical treatments over there. We still think we're a little better in the United States. Yeah. Any other general questions? Thank you very much. Thank you. Thank you so much.
To the right of the blood test, it says immune to it. If she's immune to it, then she's all right. It says on the blood.
HPV?
HPV.
You're talking about?
Yeah, my niece, it said she had a 1, tiny bit, but on the right it said immune to.
You're not talking about hepatitis B vaccine.
No, I'm talking about that this is mentioned as an vaccine.
HPV?
Yeah. It just said it had immunity to it.
I'm not sure. I kind of really need to see the paper. Yeah. Yeah, you can give me a call or yeah.
But no, that's that sexual kind of thing, HPV vaccine.
Yeah.
Oh, it said that she was immune, has immunity to it. What does that mean? Immune to it.
I need to see the paper.
But could you tell me what an immune means?
Immune means that she might have been